Hello, my name is Natalie Ehlke, and I am here to discuss Cochlear's Bone Conduction Solutions portfolio. So our agenda for this presentation will be a brief introduction, a review of your Cochlear support resources, and then absolutely a nice deep dive on the current bone conduction solutions that Cochlear offers. So the objectives will be to define candidacy for bone conduction solutions, name the three main systems in Cochlear's bone conduction solutions portfolio, and describe considerations for each solution. And then finally, to list two services that Cochlear provides for bone conduction recipients and describe the benefits of each offering. At Cochlear, our mission is to help people hear and be heard. We empower people to connect with others and live a full life. We transform the way people understand and treat hearing loss, and innovate and bring to market a range of implantable hearing solutions that deliver a lifetime of hearing outcomes. So to review your Cochlear support resources, locally, your support team consists of myself, Natalie Ehlke. I'm an area manager and an audiologist. I live in the Chicago area and provide both clinical and surgical support. We also have my colleagues, Kaylee Babich, also an audiologist, associate clinical territory manager, providing clinical and surgical support. And then we have Jessica Melton, also an audiologist, a regional director. Stephanie Gutzmer, also an audiologist. She is our Cochlear Provider Network Territory Manager here locally in the area. Then we have Megan McKenna, who is our Candidate Engagement Manager, and Laura Chesky, who is our Recipient Solutions Manager. Here you will see a phone number for audiology on call and device troubleshooting service. So the number you might call if you are with a patient real time and would like support for software, troubleshooting devices, or programming, you can call 1-877-883-3101 and simply follow the prompts, but it will be option 2, and this will connect you to an audiologist for live support. Additional resources for yourself as a professional would be listed here. So our customer service team is called ProCare. So you see their email, procare@cochlear.com, and their phone number. You do see a link to our professional website and our blog and the school resource center. Also listed here are resources for our recipients, so those who have an implantable solution. So they can email customer@cochlear.com or call them. We do have a recipient support page and an excellent YouTube channel with many videos for how to connect and pair devices, etc. Here's a slide that shows Cochlear's portfolio of hearing solutions, so both acoustic implants and cochlear implants. So for those patients with conductive or mixed losses, with a condition impeding sound from getting through the outer or middle ear to the nerve, acoustic implants can be an excellent solution and help overcome that air-bone gap. So children with microtia or atresia could be candidates for acoustic technology. In this category, Cochlear offers non-surgical bone conduction systems and surgical bone conduction systems, including Baha, Connect, and Ossia, which we will talk about in detail later in the presentation. Cochlear implants are for patients with moderate or severe to profound hearing loss, approved for 9 months of age or older, with damage to the inner ear or hair cells in the cochlea, for whom electric stimulation to the nerve can restore hearing. Traditionally, patients needed to have this severe to profound degree of hearing loss in both ears to be a candidate for a cochlear implant, but now patients with single-sided deafness with one normal ear and one ear with a severe to profound loss and poor speech understanding can consider a cochlear implant or a bone conduction solution. So there are now overlapping indications for this category of patients, as Cochlear received FDA approval of CI for SSD for those 5 years of age or older. We have had approval for bone conduction for SSD patients since 1990. Now getting into more details on our bone conduction solutions. So in this image, you actually see a young child with bilateral Baha Connect solution. That's an implantable surgical device with a percutaneous abutment. And I believe these are Baha 6 devices that he's wearing. First, we'll start by taking a look at Cochlear's history in bone conduction. For almost 14 years, Cochlear has been bringing innovative bone conduction solutions to the market to better meet the needs of you and your recipients now, while still innovating for the future to ensure Cochlear recipients hear now and always. So you can see certainly there's been an evolution to both the external sound processor and the implantable solution piece as well. So in 2019, Cochlear brought the first active Osseo integrated device to the market. This was Ossia. And in 2021, we had a premium sound processor, the Baha 6. That is the most recent bone conduction solution that we have released to the market. Now we'll review indications for cochlear bone conduction solutions and the recipient journey. So our bone conduction solution portfolio is indicated for patients of all ages with conductive hearing loss, mixed hearing loss, up to 65 dB bone conduction PTA, depending on the solution, and single-sided sensory neural deafness. While we know that children are more likely to have only conductive hearing loss and adults will have some degree of sensory neural hearing loss on top of the conductive component, it's important to remember to always look at the individual and their specific needs. As far as why bone conduction for mixed or conductive hearing loss, some reasons here are that the greater the air bone gap, the more a system will outperform hearing aids. Hearing aid prescriptions for conductive and mixed hearing loss require more gain than for sensory neural hearing loss. And hearing aid fittings can absolutely be difficult if there's a draining ear, pain in the ear, or a mastoid cavity present after mastoidectomy. Solutions to consider, reasons why we would consider a bone conduction solution for single-sided deafness could be that the Baha and the osseous bypass outer and middle ear, so they send a clear, more crisp signal to the better inner ear. This could improve speech understanding in noisy environments. It will help lift the head shadow effect. It could reduce the psychosocial consequences associated with hearing impairment and may absolutely bring long-term patient satisfaction and hearing benefits. So in looking at the product portfolio that we currently have today, it's a pretty wide portfolio, and we're proud to offer that. And it's really tailored to the patient and their individual hearing journey. So first, we offer the Baha Start. So you've likely worked with SoftBands or SoundArcs, which have been paired to our Baha 6 Max sound processor. So this would be a non-surgical bone conduction solution. Again, the term that Cochlear uses for this option would be the Baha Start. Our surgical bone conduction solutions consist of the Baha and osseous systems. You're likely familiar with the Baha system, which is a percutaneous connection that goes through the skin to connect to the sound processor. The osseous system is a transcutaneous option, so the implant itself is all under the skin. There is a processor on the outside, and it is coupled through a magnetic connection. As you know, with pediatrics, there's often a pathway from a non-surgical option to a surgical option as they get older, which we will discuss shortly. Here is an overview of Baha system candidacy. So this is a solution that is indicated for patients 5 years or older who have single-sided deafness with an air conduction pure tone average at 500, 1, 2, and 3,000 kilohertz in the better hearing ear, less than or equal to 20 dB. Or the second category of patients that could benefit from this technology could be those with a conductive or mixed hearing loss. And for those, the indication is looking at their bone conduction PTA at the same frequencies, and this must be 55 dB or better for the Baha 6 Max sound processor, or 65 dB or better for the Baha 5 Superpower sound processor. Baha candidacy is a bit more expansive than that for osseous, so it may be actually a solution that more patients could benefit from. So we'll talk about osseous in just a moment. First, I wanted to point out what we said earlier about the term indication, and that this is something different than candidacy. So an indication is the rule or guideline based on audiometric data. It's included in the package insert as our FDA guidelines for use. Candidacy, on the other hand, is about the whole patient, all the additional factors that may be equally, if not more important, than simply following an indication for a device. It's more than just the audiogram. Candidacy is about the whole person, and this is where we would consider those areas discussed earlier, like the results of a demonstration, hearing health history, goal setting, and other health concerns. So remember that while the Baha indication states that patients must be 5 years or older to have a surgical bone conduction solution, patients of any age could use the Baha Start solution. There are reasons why older children and adults may either not want surgery or they might not be eligible for surgery. So they could still benefit from bone conduction using a non-surgical option. Here is the osseous system candidacy guidelines. So this is similar to Baha with the exception of 12 years and up and the 55 dB bone conduction threshold PTA. So again, the two categories of patients who could benefit from the osseous might be those with single-sided deafness, so with their better hearing ear having an air conduction PTA of 20 dB or better, and then those with conductive or mixed loss, again, that threshold for their bone conduction needs to be 55 dB or better. And if you have a bilateral candidate, they really should have symmetric bone conduction thresholds, so less than 10 dB difference between the ears on average, or less than 15 dB difference at individual frequencies. Here is a flow chart on the bone conduction portfolio. So it's really like a selection guide or a resource that you as a professional may reference when considering the solutions for a patient or a candidate of yours. So starting on the left, you might first just wonder, is this patient a candidate for a bone conduction solution? So you would think if they fall into either the single-sided deafness category with their better ear having an air conduction PTA of 20 dB or better, or do they fall in that conductive or mixed hearing loss with a PTA of 65 dB or better? If yes, then you might demonstrate bone conduction. So you could do this using a test rod or a soft band or that sound arc. So you would couple likely a Baha 6 Max sound processor to one of those wearing options. You could program it specifically for the patient or use test settings and then allow the patient to wear the device during counseling or on a trial basis. Then you would consider the age of the patient. So are they 5 years of age or younger, or are they unable or unwilling to have any surgical procedure? So if yes to either of those, then you might consider, again, a non-surgical system. So the patient could wear that Baha 6 Max sound processor on a soft band or a sound arc. If the patient is a candidate for OSSEA, you'll want to be thinking about these things. So are they 12 years of age or older? Do they have single-sided deafness, again, with their good ear having an air conduction PTA of 20 dB or better? And then are their bone conduction thresholds 55 dB or better if they fall into that conductive or mixed hearing loss category? So if no, then you're going to need to consider something else. So that would likely be a Baha system. So maybe, again, you have a patient with bone conduction thresholds in that 60, 65 dB range. So that would be outside of the indication for OSSEA. So you might consider a Baha superpower device on a Connect system. But if they do fit those OSSEA indications, then of course you're going to be thinking about OSSEA as an option for them. And other things you might think about here might be, do they need serial MRIs? And if so, maybe the Baha Connect solution is a better option for them. The current MRI indication for OSSEA is actually that internal magnet can stay in place and their head can be wrapped with a special Cochlear MRI kit that would allow them to have an MRI at 1.5 Tesla with that internal magnet in the OSSEA still in place. And now if we go ahead and come up with some examples and talk through options for specific example patients. So here, the treatment pathway for baby. So in this case, the best choice would be to provide specifications of Baha start. So like the Baha 6 Max sound processor on a Baha softband. So the goal would be to help patients here now and always. So in this case, the patient might begin with the Baha start and transition to a surgical solution when appropriate. So Baha at 5 years or OSSEA at 12 years. Studies have shown that unilateral conductive hearing loss due to oral atresia was shown to negatively impact academic performance in children. One study showed that 65% required additional resources in educational settings. Our next example would be a young child. So this might be a young child with Down syndrome who has conductive hearing loss developed early in life due to recurrent ear infections. So again, the best choice here would be to start by providing amplification through the Baha Start solution, non-surgical. So a Baha 6 Max on a soft band or sound arc. Once the child turns 5, if appropriate, they could consider the Baha surgical solution. Since this is a younger child, you can see the trial or time with Baha Start is shorter. A retrospective case analysis actually showed that bone conduction hearing systems significantly improved the quality of life of children with Down syndrome, and that both patients and caregivers were highly satisfied with this system. Our next example is one of an older child. So this is a teenager who woke up one morning with sudden profound sensory neural hearing loss in one ear. So the best choice would actually be an implantable solution such as OSSEA after an evaluation and demonstration using Baha Start. A clinical study showed that hearing recovery rates in children are 72%, but in cases of profound hearing loss, the hearing recovery rate is just 60%. Our next example would be an adult. This adult had chronic otitis media, underwent middle ear surgery to address the infection, but the mixed hearing loss remained. So here, the best choice would be to provide an implantable solution, such as OSSEA after an evaluation and demonstration using Baha Start. A systematic review of 1,390 patients concluded that hearing rehabilitation through middle ear surgery is typically unsuccessful in 30% of patients. So again, it is important to consider at what point you might discuss a bone conduction solution with patients with middle ear infections or just a history of middle ear surgeries. Now let's review the Baha 6 Max and Ossia sound processors and features. As a reminder, Cochlear has both the Baha softband and the sound arc that can deliver efficient transmission of a sound processor, transmission of sound when paired with the Baha 6 Max sound processor for long-term use, or it could be used to demo a bone conduction solution for a patient. So again, you might consider programming a Baha 6 Max sound processor in the clinic to the patient's audiogram. If they're able to respond to you, you could do in situ testing as well to create their gain in their device. And then you could couple that, of course, to a softband or a sound arc and just demonstrate it in the clinic with the patient or loan it out for them to try. You can see the images here again of these wearing options and a close-up of the Baha 6 Max sound processor. This processor has dual microphones, a visual indicator light, one button on top for changing programs or activating or deactivating streaming to wireless accessories such as a mini microphone or a TV streamer. And it also has low profile snap coupling. So the coupling that connects the device to either the softband, the sound arc, or the Connect is lower profile than it was with the Baha 5. So this device actually sits closer to the head and it's just a more discreet wearing option. 6 features of the Baha 6 Max in summary are that the Baha 6 Max is a premium sized power sound processor. So it is small like the Baha 5, but it has an increased fitting range up to 55 dB. It is more discreet with that lower profile coupling. So this is really nice for all patients, but especially for little heads and younger children. There is more connectivity built in into the Baha 6 Max sound processor. So not only is it compatible for direct streaming with Apple products, it is also compatible with Android products. It does have a longer battery life. So on average, you might expect 5 to 7 days on a Baha 6 Max. It is dust and water protected. So it has an IP rating of 68. So it is really ready for some water adventures. If splashing or just a little bit of water hits it, again, that's okay because it is an IP68 rating, but it does not have a full waterproof case at this time. And it is ready for the next generation connectivity with Bluetooth LE capabilities. Cochlear does recognize the importance of providing early access to sound to promote optimal speech and language development. So Cochlear created the Lend an Ear program. This program allows faster access to sound for children that are 12 years of age or younger and that are candidates for bone conduction. So clinics will simply request a Baha Start solution that consists of a Baha 6 Max and the softband or sound arc loaner device while waiting on the reimbursement insurance approval process. This unique program is a loan-to-own concept where Cochlear provides early access to bone conduction equipment with the intent to transfer ownership of that loaned device to the patient after insurance approval has been obtained. So it's really helping children get in sound faster while insurance approval is being obtained. So finally, let's go ahead and take a look at the Ossia solution. So this is an active transcutaneous option with a piezoelectric transducer. So there is an implant all under the skin that is called the OSI 200 implant. It consists of electronics in a transducer portion, and then it has a coil area and a magnet. This whole implant affixes itself to a BI 300 implant, which is the same initial implant used for Baha. Or the Ossia implant then is fixed or screwed into that BI 300 implant. So that is all under the skin. The transducer of the Ossia, again, is a piezoelectric transducer. So some key benefits and features of the Ossia system include that it is powerful. So it has a through the skin connection that is not only aesthetically pleasing, does not require site or tissue maintenance like that of a percutaneous abutment might. and it provides excellent hearing, including in noisy situations where patients often struggle the most. Again, it is piezoelectric, so this transducer allows for excellent high frequency gain and clear sound for improved performance for patients. ASIA sound processor and the system is compatible with true wireless accessories such as the mini microphone, TV device, and remote control. It is made for iPhone and can stream again directly audio from an Apple product to the processor. And it can be used with the Cochlear ASIA Smart app, which is available for both Apple and Android products. It has a waterproof Aqua Plus case for underwater adventures, unlike the Baja 6 Max. So truly can swim underwater with this Aqua Plus case and the ASIA sound processor. So when you look at the ASIA sound processor, again, it has dual microphones. It has a single button for changing programs or activating or deactivating streaming to wireless accessories. It has a visual indicator light. It has an area where a retention line or a safety line could be added for just extra peace of mind that if it falls, it won't fall off. The processor does have a magnet. That is how it retains on the head to communicate through a digital RF link of the sound through the skin. And it does have a disposable battery. An implant power battery must be used with the ASIA at this time. So thank you so much for your time and attention to this presentation on Cochlear's bone conduction solutions. Please do not hesitate to reach out to our Cochlear team if there's anything we can do for you or your patients.